Welcome back to OMFS Essentials, concise knowledge for the modern maxillofacial surgeon. In this episode, we'll explore one of the most fundamental topics in surgical practice, the types of suture materials, both absorbable and non-absorbable, along with their history, properties, and clinical applications. Selecting the right suture material is crucial for achieving proper wound healing, minimizing infection, and maintaining tissue strength. Sutures can be broadly divided into absorbable and non-absorbable, depending on whether they are degraded and absorbed by the body or remain permanently in place. Let's begin with the most traditional material, catgut. The name catgut is actually a misnomer. It comes from the old term kitgut, referring to strings used in early musical instruments. Historically, Lord Joseph Lister treated catgut with carbolic acid to sterilize it, and later with chromic acid to reduce tissue reaction and prolong absorption. Catgut is made from the submucosa of sheep intestine, which contains elastic tissue providing high tensile strength. It is sterilized by gamma radiation or ethylene oxide and preserved in formaldehyde and alcohol. Plain catgut retains strength for about 10 days, chromic catgut for about 20 days, and both are fully absorbed within about 100 days through enzymatic digestion by inflammatory cells. Uses: plain catgut is used for ligating small vessels and closing subcutaneous tissues, while chromic catgut is used for medium-sized vessels, peritoneum, muscle, and intestinal anastomosis. In plastic and cleft surgeries, finer sizes like 5/0 or 6/0 are preferred. Chromic suture variants. Depending on the degree of chromic treatment, Type A, plain, 10-day absorption, Type B, mild chromic, 20 days, Type C, medium, 30 days, and Type D, extra chromic, about 40 days. Absorbable synthetic sutures. Modern surgery increasingly relies on synthetic absorbable materials, which are stronger, more predictable, and less reactive than natural catgut. 1. Polyglycolic acid, or Dexon. A braided synthetic polymer available in green color. It retains about 55% tensile strength after 14 days, 20% after 21 days, and is completely absorbed in roughly 100 days by esterase enzymes. Advantages include minimal tissue reaction, uniform absorption, and excellent knot-holding properties. Uses include intestinal anastomosis, pedicle ligation, biliary, thyroid, splenic, and cosmetic surgery. 2. Polyglactin 910, or Vicryl. A violet-colored braided copolymer of glycolide and lactide. It retains 55% of its strength at 14 days, 20% at 21 days, and is absorbed within 60 to 90 days by slow hydrolysis. It causes very little tissue reaction and handles beautifully. Uses include intestinal and laparotomy closure, thoracic and mucosal suturing, cleft palate repair, and pediatric surgery. 3. Polyglycanote. A monofilament copolymer of glycolic acid and trimethylene carbonate. It retains 70% strength for 2 weeks and 55% for 3 weeks, fully absorbed in about 6 months. It is supple, flexible, and easy to tie. Used for general soft tissue surgeries. 4. Polydioxanone, or PDS. A monofilament synthetic suture available in blue, violet, or clear forms. It retains 70% strength for 2 weeks, 50% for 4 weeks, and is absorbed by 6 months. Ideal when long-term strength is required under tension, such as fascia or deeper closures. 5. Polyglycaprone 25, or monocryl. A monofilament copolymer of glycolide and epsilon caprolone. It maintains 60% strength for the first week, 30% for the second, and is absorbed within 3 to 4 weeks. Used where rapid healing is expected and minimal foreign body reaction is desired. Now, let's move to materials designed to remain permanently in the tissue unless removed. 1. Silk. A natural braided suture made from silk filaments. It is black for visibility, and though technically absorbable over long periods, it is classified as non-absorbable. It ties smoothly, is inexpensive, and widely used for skin closure and general soft tissue approximation. Disadvantages include higher infection risk and possible granuloma formation. 2. Nylon, or ethylon, or dermalon. A synthetic monofilament made from nylon 6, or nylon 6,6. It is strong, smooth, and causes minimal tissue reaction. However, its strength decreases slowly due to hydrolysis. Uses include skin closure, plastic and ophthalmic surgery, and microvascular procedures. 3. Polyester, a braided synthetic fiber with high tensile strength and minimal tissue reaction, commonly used for cardiovascular, ophthalmic, and general soft tissue surgeries. 4. Polypropylene, or proline, or sertraline, a monofilament isotactic crystalline polymer, highly inert and resistant to enzymatic degradation. It remains indefinitely, has a very smooth surface, excellent visibility, and is the least thrombogenic of all sutures. Uses include plastic, vascular, cardiovascular, tendon, and hernia repair. 6. Surgical steel. An iron-nickel-chromium alloy used when maximum strength is required, such as sternal, abdominal wall, or orthopedic closure. It is non-absorbable, inert, and encapsulated by fibrous tissue. 6. Surgical cotton. A twisted, natural cellulose fiber. It is inexpensive and easy to handle, but has high capillarity, promoting infection, and poor tensile strength after autoclaving. Used mostly for general ligation where infection risk is low.
Metal sutures and staples. Metal clips and staplers, first developed in Hungary by Hummer Holt, provide fast and reliable closure and are particularly useful in gastrointestinal surgery. Stapling reduces operative time and tissue trauma. Skin staples are also used for skin closure, graft fixation, and emergency lacerations. Tissue adhesives and glues. Cyanoacrylate adhesives are used for quick skin closure when perfect hemostasis is achieved. Fibrin tissue glue, derived from fibrinogen and thrombin, is used for hemostasis in liver, spleen, neurosurgery, ENT, and ophthalmic procedures. Ligating clips and wound closure strips. Ligating clips, absorbable or non-absorbable, offer quick and secure hemostasis in deep or narrow spaces, though they don't approximate deep tissue well. Cluceron and ethis strips are adhesive tapes used to reinforce skin closure, prevent scar spreading, and allow wound observation. Vacuum-assisted closure. Finally, vacuum-assisted closure applies controlled negative pressure to promote uniform wound healing, a modern method that speeds up recovery in complex wounds. Understanding suture materials, their composition, behavior, and tissue response is essential for every maxillofacial surgeon. The right choice of suture enhances healing, minimizes complications, and ensures optimal surgical outcomes. You've been listening to OMFS Essentials. If you enjoyed this episode, don't forget to subscribe and join us in the next one, where we'll continue exploring the principles and practice of oral and maxillofacial surgery. Until next time, keep mastering the essentials.